next talk by Dr. NEERAJ ISRANI and the discussion by Dr. Sandeep Nagwekar.
Okay, we can start the timer and the video. I'm Dr. NEERAJ ISRANI and my innovation is DRAPE, which is a novel disposable speculum with eye drape. Yeah, start the video, please.
To you, DRAPE, a novel disposable speculum with eye drape. Post-operative endophthalmitis is the most dreaded complication for a cataract surgeon. Eyelid infections leading to contaminated surgical fields are the most common reasons for this. Improper draping, as seen here, is one of the leading causes for this. Hence, to put emphasis on proper eye draping, we need to first get rid of the conventional ways of eye draping. The steel speculum, on the other hand, is proven to cause eyelid tissue damage and lead to pain, ptosis, and difficult to put in deep set eyes. Thus, we had a research question so as to come up with a speculum and a drape combined to make it easier, faster, and patient friendly. Hence, we developed the DRAPE, which has all the above features on a CAD file and 3D printed the first prototype. The DRAPE not only has a draining outlet for the fluid, but is extremely elastic and designed to completely cover the eyelashes. Here is a demo of the DRAPE on a patient. This is the 3D printed prototype, which is assembled with the adhesive skin part of the eye drape. The DRAPE has an outlet which will drain the fluid into the pouch as seen over here. As you can see, once we strip off the plastic, like any other eye drape, it is adhesive to the skin. Further, the inner ring will go and engage in the lower and the upper tarsal plate. And since this is a 3D printed device, the stretch is not enough, but ideally it will completely stretch and give a very wide field of surgery to the surgeon. This is the CAD file for the latest prototype, which consists of two parts which are joined together with the help of a screw. This screw will help us to increase or decrease the surgical field depending on the surgeon. Final autoclavable prototype is in works and will be available very soon. Thus, the advantages of the DRAPE would be that it is less time consuming since it is a one-step procedure. It not only is a less cumbersome procedure for the patient, but also make sure that the entire eyelashes are covered, thus reducing the chances of any infection.
Thank you. So just want to add one small thing that we've already spoken to a leading drape manufacturer and it will be autoclavable and available very soon. Hopefully made out of SMS and poly material. This was just a 3D printed materials for conceptual basis.
So Neeraj, thank you for the presentation. Very nice idea.
Yeah.
In fact, I'm impressed that you're probably going to prevent the fluid getting into the drapes around, you know,
Yes.
because one of the main problems for me is not the concern of the eyelashes putting the infection, which anyway you're sterilizing or preparing the patient. But the nasal side, very often it gets wet.
Pooling.
And when pooling takes place, the drapes get wet.
Yes.
And we know that on skin, if the drape gets wet, the sterility is gone.
Yes, sir.
So is this going to ensure that those parts will be completely dry?
Absolutely. So that is another good point that I will definitely add in the next presentation when I make it.
Yeah.
And it will also be useful for intravitreal injections because it's just a one-step procedure, quick and faster also. And the thing is that only one catch that I had with this was that how to make it stretchable. So we found the exact material, and we're also trying to reduce the carbon load because, like how Arvind is doing, so we're working on a material which will have less carbon emission also.
Yeah. The second concern is, since this is at two levels,
Yes.
it's probably during FACO going to impair the entry of
No,
instrument.
sir. That we've worked up all.
You know,
This was the first thing that
because
we,
it's quite broad.
this
And
is a 3D printed.
everything in FACO is like, you have to get in at the right angle and stuff
It's
like
going
that.
to be very minute, very thin. Only the rings made out of poly material will be the thick ones. So that we've sorted
And
out.
the third thing is I saw you, pulling the lids apart with your fingers.
Yes.
So,
Again, the chance of
Yes,
contamination.
so with the bud probably, or it's going to be so stretchable that you just have to ask the patient to look down with a bud just everted and it'll engage into the tarsal plate. So yes, this video I've used my fingers. I realized it later, but you have to
Dr.
use a
Ashish
bud.
to get ready. Dr.
So
Ashish.
while the upper and lower lid are getting stretched, what about the nasal and temporal?
So the new model, if you see, we added a screw which will again be of poly. So it will open like a shivling, it will be open like this. So that part will be open, and then depending on the surgeon's compatibility, whatever the surgeon wants, he can open the field of vision or decrease it accordingly. So that problem will also be solved with a screw made out of poly material.
Right. Yeah.